Okay, so I chose to do my presentation on joint attention. The reason I chose this um, early intervention strategy is because we have recently made a protocol for one of my clients that was based on the article that I'm going to be presenting on in this presentation. I figured this would be a good chance to inform you all of what we changed from the article when implementing with my client and what we kept from the article. So just a little introduction to joint attention, which I know all of you know from this class. Joint attention is recognized as one of the earliest forms of communication in young children and involves coordinated attention between a social partner and an object or event in the environment. It involves the intentional communicative act. It involves sharing mental states with another person and demonstrates the individual's awareness of the mind. And it is a driving force for learning the language from others because the nonverbal meaning is being shared. Kind of like that, you're seeing what I'm seeing, you're thinking what I'm seeing, kind of checking in with that mental state of your partner. Research have distinguished two forms of joint attention. So the first one being the response to another person's bid, and then the initiations for joint attention, which are again two things that we have learned in this course. One thing about this that I really liked is I did a little presentation on joint attention for my work, and I think that this image really illustrated what joint attention is, and it made it really simple. So it's a child's ability to focus on both the partner and the object at once through gaze shifts between the person and the object. So the child is communicating with their partner about the object. So it's kind of saying joint attention is in the middle of the object, the partner, and the child. And kind of those are the three components of joint attention. So I just thought this was a super interesting and easy way to kind of capture and know joint attention for what it is. One thing that I think in the clients that I have worked with that gets missed in joint attention is that looking back. They necessarily will make a comment about joint attention, but sometimes that checking back in with their partner is what gets missed from my experience. So in the article chosen, I chose Teaching Children with Autism to Respond to and Initiate Bids for Joint Attention, and this was by Taylor and Hotch in 2008. The article was found in the Journal of Applied Behavioral Analysis, or JABA, and this is just a journal that I really like to look for interventions because it ensures that they're peer-reviewed and it is a well-known journal in the field of ABA, considering it's the Journal of ABA. The key components of the article that I was looking for my particular client. So a little background on my client. She is 4 years old and she has a lot of language, a lot of scripting still, but a lot of socially appropriate language. Very ahead academically, but really struggles with using novel social descriptions of things and social interactions with peers. So the age of the participants is one thing. When I was doing my literature review, to find an intervention that would work for her was the age of the participants. The setting and the feasibility of the intervention was another. I wanted to make sure that this was an intervention that could be implemented both in home and the clinic that I work with her. So feasibility. And then the vision of peer training. So when I was looking through the articles, I thought that although this article didn't look at peer training, that the methodology could be used for peers or could be implemented with peers, which is another thing I really wanted because my client especially responds to adult attention a lot and is very, very into communicating with adults but lacks motivation to interact with peers. So using typical peers to help her with this intervention I thought would be a super great opportunity. And then obviously kids that have an ASD diagnosis I also wanted within this article. So then kind of the overview of the study. So there were 4 dependent variables and 4 independent variables for this study. I know they're listed, but I can kind of just go over them. So the 4 dependent variables were the percentage of trials where the client looked at the target item in response to the therapist point. So the therapist points and says, look at that doll hanging from the ceiling, and the percentage of times that that client does appropriately respond to that point. The second dependent variable was the percent of trials where the client comments appropriately on the target item. So not after the point, and then having that child to respond. So again, just the percent of trials that they do. The third one was the percent of trials when the client looked back at the instructor, and then the next one is the number of bids for joint attention initiated by the child. So as you can see, that this intervention kind of captures all the different parts of joint attention. It's not just looking at initiating, but it's looking at gaze, looking at appropriate commenting, initiating, and responding to bids for joint attention. And then the independent variables being the presentation of the verbal directive, the presence of the items, the instructor's response to the child's comments, and the correct use of prompting strategies. So that's kind of the overview of what the researchers are looking for. So another thing about this article is it's very broad. It's looking at joint attention very as a whole. It's not teaching one specific part of it. It's kind of just teaching it as a whole. And one thing I did like about this is you could teach it as a whole if they needed it, but you could also just pick out parts of the intervention, like if they have trouble responding or if they have trouble interacting with, to your point, you could just focus on that part of the intervention. So then a functional relationship. So these researchers did find a functional relationship between the verbal directive and the presence of the target item and the total number of bids for joint attention initiated. So that verbal directive of, look, client, at that doll hanging from the ceiling, or just having a novel item in the participant's environment and seeing if they give a bid for joint attention, like, are you seeing what I'm seeing? So some of the things that they would have you bait the room before this intervention. So you had 5 things. One was a doll hanging from the ceiling. One was having a scary mask in the room, kind of just novel things. And I think they give really great examples of using everyday things that the kids might see, but using them in an atypical way. So it's not like you have to buy all this new stuff for this intervention. It's just using what you have in a very novel way, which I really liked. And again, back to the functional relationships, they did find a functional relationship between commenting about the item and the prompt strategy. So this is more so looking at if the child did make a comment about the item based on the prompt strategy. So when I say sometimes scripted, in the article they talk about how one of the participants' responses were very scripted because of the verbal prompts used. So they talked about fading that verbal prompt and using a different prompt sequence because it was sometimes scripted. So although yes, prompting a child to make a comment, there was a functional relationship between using that prompt strategy and then fading it for the child to make a comment, but sometimes those comments were scripted because it's verbal examples that you had given the child, if that makes sense. And then they also found a functional relationship between having the item present and then pointing and looking at the item. However, they did not find a functional relationship between looking back at the adults and then training on initiation for joint attention, which I thought was interesting. We'll kind of get into the reasons why here in a bit. So the methodology strengths kind of this article that I really saw of benefit for the client that I was going to be using this with is the current study appears to be the first one to have used only adult attending stimuli and social engagement as consequences for responses and initiations to joint attention. And although it says only adult attending, like I said, I thought that this methodology had the opportunity to be used to train typical peers to work with my client and kind of getting that peer interaction for joint attention. And again, this is social engagement, so that was the main reinforcer used. And of course, it's not going to work for every kid. Obviously, kids are reinforced by different things, but for my kid, this is definitely what was going to work and what she is most reinforced by. And I liked that it taught all components of joint attention. It taught both responding and initiating. It didn't look at just one. It was kind of a whole picture. And for this point in my clients' goals, that was what we really were aiming for. And then the technological dimension of ABA was something that I thought this article did really well. When I was reading the whole article, I did not have any questions about how to implement it. They did an awesome job explaining baseline. They did an awesome job discussing the training sessions, how they trained the therapists to take data, how they trained initiation, how they trained responding. I just thought they did a really good job making it as clear so that anyone could come in and pick it up and implement this intervention, which from experience and from taking components of this intervention, I definitely believe it hit that technological dimension. And then another thing about this is they provided examples after the description of each independent variable was explained. So they would give kind of the overview of what initiating joint attention bids looked like, but then they also gave an example of what that would look like kind of in real life setting, which also made it easier to understand. And then also methodological strength, if I could talk, was the feasibility of the intervention. I thought it seemed pretty feasible to do in either a clinic or home setting or a school setting, because like I said, the materials are everyday materials. You didn't have to go out and buy stuff. They were just used in a novel way, which I really appreciated, because I know in this class especially we have talked about in ABA you usually bring this fun toy bag in, and it's all these new and exciting things for the kid, but then you leave and what do the kids don't have any of that at home. So kind of incorporating that stuff from their natural environment into the intervention. So limitations of the study, there were a very low percentage of responses that appeared to be due to the inconsistency in the responses of looking back at the instructor. This article didn't set a mastery criteria. Their mastery criteria didn't include several consecutive sessions. So it was very unclear of when mastery was met, which is obviously a big limitation and something that was on the quality indicator checklist. We don't know when mastery was, which makes it hard to know if and when the kids did acquire the skill. And then when a participant would initiate a bid about an item that wasn't included within the intervention, they were not counted. They were just redirected, which I also think is kind of those missed opportunities for that natural environment teaching, which I think is something that the researchers missed out on this. And then, like I said, mentioned a little bit before, some were scripted responses, and the quality of responses did not appear to resemble those of typical peers. So if you were teaching a child how to respond to bids, the phrases used they weren't variable enough. There were just a couple comments used, and in some situations were not appropriate. So making those responses scripted and not as good in quality. So some of the results of the study, so it does support research that indicates that some children with autism engage in some components of joint attention without specific instruction. So they didn't need to train looking in the direction of the point. But those were only for the participants in the studies. I don't think I mentioned it. There were 4 participants in this study. But for those kids, they didn't need to train on point. But for some kids, you do. Some kids don't have that skill. But that was one of the things that they saw as important to note. And then learning to respond to bids for joint attention also did not lead to the skill of initiating bids. But the findings do support that socially relevant stimuli are necessary and functional reinforcers for some of the responses associated with joint attention. And then reinforcers were social in nature and increased the likelihood that initiations would serve as means for social reinforcers and not for tangible items. So the reinforcers in this were all social. It was all very verbal and directive reinforcement, which for some kids that will work and some kids that will not work. Obviously, if there's a kid that's not reinforced by um, social praise, then these reinforcers will not likely increase this child's chances of engaging in joint attention. For the specific client I'm talking about, they are very reinforced by social praise, so it was a good fit for what I needed. So kind of how will this intervention impact my practice? I think for sure ensuring that all interventions have social relevance to the client being implemented with. So kind of like that social validity that we've been talking about all semester. Is it socially relevant for the client? Is obviously super important when thinking of not only a joint attention intervention, but all interventions that you're using with a kid. And also ensuring that appropriate reinforcement is provided for children through intervention. Like I said, this study uses social praise, which is great for some clients, but not for all clients. And then another thing of how this will impact my practice is obviously ensuring that the technological dimension of ABA is being met. I think this is especially important for the RBTs who will actually be implementing the intervention and making sure that it's the same across all parties. I see this missed a lot in my work as an RBT. When you have a lot of RBTs on the case, this technological dimension gets kind of fuzzy and people start implementing things in a way that may not be implemented with fidelity. So kind of ensuring that that technological dimension is met and the protocol is written out very clearly and very precisely of how it's supposed to be ran. Will obviously make your intervention as effective as it can be. And then another thing that this article did not include was a plan for generalization across individuals and settings, which is something that I think is necessary because I know that is one of the downfalls in the ABA world is the ability to generalize between settings. So I know that after reading this article, that is something that I needed to include it in my intervention for my client, and then also a plan for prompt fading. One thing that we have decided after kind of assessing the protocol that was written off this article is with the verbal prompts, we know our child will likely script the responses that we provide for her, and she can read. So we have talked about using an intervention from a different article that looks at writing a bunch of phrases on cards, and when we want that response, just gesturing to the card and having her read that response instead of giving that verbal SD or that verbal prompt, because she is so verbally prompt dependent on our verbal language. If that makes sense. I know it's kind of confusing. So just having a plan for prompt fading, and if before we even started this intervention, we knew that verbal prompt fading was going to be very hard, so we just kind of eliminated verbal prompting as a whole. And then how will we apply what I've learned? So I think it is important to target joint attention skills in early intervention programs, obviously. That's been a huge focus of this whole semester. And I also think developmental assessment is important to establish, to know where you're starting with joint attention programs and know, is it developmentally appropriate for this child to be learning joint attention? How far are they behind from their typical peers? That sort of stuff. And then also children who are at risk for autism should be involved in programs that teach joint attention skills. And parents and clinicians should work together on developmentally appropriate programs for at-risk children and those diagnosed with ASD. So what I will do differently, I will incorporate aspects of this intervention with aspects from other interventions, which, like I said, we have done instead of using verbal prompts to teach both how to initiate and respond to bids. We have now incorporated sight cards, so she will read phrases and we will just gesture those instead of verbally saying them, because we know that she will become scripted. Her responses will become scripted and not always appropriate. And obviously I will include a plan for generalization, and we have kind of talked about, she has some days in the clinic and some days at home, so we have talked about taking data on this both in home and at the clinic and kind of then comparing and seeing where it goes wrong, or how it's going in both settings. And then I also said peer training. Like I said, this one didn't include peer training, but there's a kid at the clinic who is very developmentally typical socially. So we have talked about after the adults have established kind of what this intervention is going to look like across the session, kind of incorporating him into initiating bids for joint attention and having her respond to it to kind of get that peer interaction going, and kind of having him lead this intervention to help not only with her joint attention but with her peer skills, and not only wanting to engage with adults. And then I will also ensure mastery criteria based over a certain amount or percentage of times they engage in the joint attention, or over a certain amount of sessions. And then lastly, I think conducting assessments with participants, so knowing what does motivate them, kind of establishing those motivating operations for joint attention, and knowing what things do grasp their attention. And if it's not social praise, then is it an edible that they can get for doing the appropriate thing? Is it a tangible? Is it whatever it may be for them, to kind of know what that motivating operation is to increase likelihood for joint attention. All right, and then there are some references. If you guys have any other questions, please feel free to reach out. Thanks.